I'm Bill Knopp. I'm a family physician with training in primary care sports medicine. So I teach and practice medicine in St. Louis Park and Chanhassen. I was diagnosed with Parkinson's officially in May of 18. Been struggling with this probably for about 10 years. It's kind of a complex thing. I've got a spinal cord injury as well as the lucky me developing Parkinson's disease. So over the last 10 years I've been having more difficulty with movement and fluidity and walking and dexterity, particularly my right side. And my wife, who seems to find everything, found Wendy. She found it, I think, through NPR and Matt Sanford. There was a podcast that she listened to, and then one day in I think it was probably May of 18 or April, I drifted in with my young daughter.
What was that first impression when you came into her class?
I certainly didn't know what to expect, and I was expecting a more traditional yoga, although I'm by no means a yoga practitioner. So I was not familiar with somatic yoga or somatics at all. And I was very impressed, with the whole thought of, neuromuscular re-education and neuromuscular somatosensory, somatomotor retraining made a lot of sense to me. And it was very obvious from the beginning this wasn't just your kind of fancy health club yoga with music in the background or heat yoga or some fancy yoga. There were clearly people that had physical impairments. So I was curious because I certainly had not been exposed to anything like this through medical school or in my practice. And certainly as a family physician, I see a lot of patients with neurologic and musculoskeletal problems, and traditionally I've sent them to physical therapy. That's been really where they've gone. And I realized pretty quickly that there was certainly another method and certainly a way of treating people that I really wasn't familiar with this neuroplasticity and neuromuscular re-education and just looking at it in a way that I just had never been exposed.
Mm-hmm. When you decided you wanted to work with her, you quickly transitioned from group setting into more of the one-on-one experience. Why did you decide to do that?
I really enjoyed the classes, and I learned a lot in the classes. But I felt like she does a phenomenal job of giving individual attention within these groups, but there's limited as what she can do with a group. And so I felt like I wanted to spend a little more individual time delving into it and learning more. So I continue to go to the group sessions because I think they're fantastic, and I want to continue to do that, but I felt like I could gain some extra ground with the individual sessions.
That makes sense. Bill, do you mind talking about how often did you come in and see her, and what was the work you did on your own at home?
So I probably was coming in for probably 2 months or so. I pretty quickly started doing the individual sessions, and I guess doing a lot of sports medicine as a family physician with sports medicine training, I know if you don't do it, you don't get better. Whether it's getting better at a sport or trying to, do whatever therapies a doctor or a therapist or whatever provider is recommending, but if you don't do it, you don't get anywhere. Mm-hmm. So I realized that I needed to do that. And, and I obviously had a tremendous motivation, with all my physical impairments. I wanted to function better and feel better. And I felt like, what I was getting from the neurologist was certainly very necessary, but not sufficient to cover integrate everything together, because I think the neurologist is very limited. I mean, I have a superb neurologist, and she's one of the best Parkinson specialists in the country, but she comes from her perspective, and a little bit of therapy and a lot of medicine, and And the medicines are absolutely necessary, but there's a lot more to it than that. And I learned that through spending time with Wendy, because I spent hundreds of hours with physical therapists and athletic trainers and physicians and different specialties, and we just don't learn that or integrate that into the process. So I think it's more of a holistic approach, because I think you need different parts to add up to a big and healthy picture. So.
Sure. What did you say to your neurologist once you discovered how this was able to help you?
And I told her that it was immensely helpful. That I told her certainly the medicines have helped tremendously, but there's certainly something. And part of my initial diagnosis, they have you spend an entire day at the Struthers Parkinson Center at Park Nicollet, and you see an occupational therapist, you see a physical therapist, you see a social worker, you see a music therapist, you see a speech pathologist, you see the neurologist, you see physical therapy, occupational therapist, you see all these people. So, part of my initial process is, okay, you got to spend some time with all these disciplines. And so I spent several hours with all of those, particularly physical therapy and occupational therapy. And and some of those things are certainly helpful for sure, but they're not Somayoga or somatics. And, so I think this is so those things are beneficial, but I think this is something definitely unique, and they're not integrating this type of thing into the Struthers Parkinson Center. I mean, there's some crossover for sure, but I think this is certainly a different perspective and an additional therapy or an additional treatment that I think they should offer. And I've talked to her about this, and she's a busy woman, so it's hard to get her to change all that. But I mean, I gave her some information. She's thrilled. She's very, very supportive. So she's not said I don't agree or anything. She's a pretty open-minded person. So I'll keep working on her.
Thank you for doing that. That's fantastic. Did you have any surprises when you started working with Wendy?
I didn't know how to breathe. Seriously, I didn't know how to breathe properly, and I realized that tension in my body and how to breathe properly, which can be part of this. And Parkinson's is exacerbated by stress, clearly. So anything that increases muscle tension or anxiety or stress is certainly going to exacerbate anything that I have. And I realized I wasn't breathing, which is also a signal that I need to also relax a little bit. But she taught me how to do that. And also, as part of this disease, even on the medications, there are certain movements, and whether it's fluidity or smoothness or being able to do certain moving my shoulder blade or moving my hand, that even with medicine I was really struggling. Wendy and I have had some humorous times when certain things don't work that I thought would work. But with this re-education, slowly I'm gaining functions that are new. And so I continue to work on it to continue to add on to that.
That's amazing.
Yeah.
Coming from a medical background, what is your message to other doctors and MDs? There's a lot of doctors and MDs out there that feel like that all the other therapies are more adjunctive. They're not necessary, but nice to have. With your experience with somatics and neuromuscular re-education and the work that Wendy Brom does, do you feel it's adjunctive, or is it necessary for you to deal with this disease?
I absolutely think it's necessary. I mean, certainly I would do better than I was doing before I went to the Struthers Parkinson Center, because it's a phenomenal place and they have all kinds of things to offer. But this, I think, is necessary. I mean, I think that there's a Parkinson scoring system that you fill out every time you go into the neurologist, and and my scores have been, from when I started with Wendy and on the medications, and I just saw my neurologist recently, my scores are better than they were a year ago, and nothing's changed except what I've done with her, because I've been on the same dose of medication for over, a year and a half. So, so I've clearly shown some improvement above and beyond the Cinemet that I use for Parkinson's, and so I am in full support that this should be part of that.
That's amazing.
Yeah.
Congratulations, by the way, that's fantastic. What is your message to people that have been diagnosed with Parkinson's, are not really sure what to do? This can be a pretty overwhelming diagnosis, and sometimes it does take a while to diagnose it, so that adds to additional stress. What is your message to patients that are diagnosed with Parkinson's?
I think it should be a team approach. I mean, I think that you absolutely need a neurologist, because this is a progressive disease, and we don't have a cure for the disease. So I think that having a good primary care physician and neurologist kind of lead the team. But I know that it's a team approach, and it's a multidisciplinary approach. So I think, but this I think is should be a key part of that treatment plan, because it's certainly not just one thing. It's not just, and life in America is, a lot of it is pharmaceuticals. You go into the doctor, you get a drug, and that's it. And that's, again, with Parkinson's, it's absolutely necessary. I mean, there's no question that I benefit from that and I need that, but that's not sufficient, because there's just so many other things that have to be, I need to re-educate my body to work properly, because it's lost its ability to do that completely, and I need guidance to do that. I mean, I can't do this on my own. This is not something that I can just go online and look up Wendy Brom and look at her video, and like a Jane Fonda video or something. It doesn't work that way. So, it's time intensive, but it's rewarding. If you do your exercises and do your work, I do what Wendy tells me to do, I get better.
That's fantastic.
I think what Wendy does an excellent job of is she's integrating some of the Eastern traditions that we haven't embraced in the West. The mind, body, and soul. We don't do a very good job of that, and Wendy does a really good job of integrating not only the somatics, but some of the yoga traditions, some of the Buddhist traditions that are integrated into this, which I think meld beautifully.
One of the things that I love about the work with Wendy is she just slows and calms you down, and then your awareness shifts. No matter what you're doing, whether working on your body or learning what your body is doing or saying. Is that something you experienced right away when you started working with her, or did that happen slowly?
Oh, no, I picked that up right away. For instance, going to the physical therapist, the occupational therapist, certainly they're telling me to focus and do the technique properly, but there wasn't an intensive focus of the mind, both sensory and motor, in that process. That's what I think is really missing, because it is a sensory motor activity, the Somayoga, and I think what I've learned from the physical therapist and occupational therapist that I've been with, it's more of just motor activity, not really the sensory part, not really the get yourself in a good state of mind, because Wendy uses breathing and focus and relaxation, and so that I'm attending to what I'm doing completely rather than being distracted, and she has a very, very peaceful air about her, and I appreciate that a lot.
So Dr. Bill, it's really interesting that you, through of course your medical background, but also through what you're dealing with, have tried so many different things. When you started your career as an MD, did you ever think that you would be sitting here talking to us about Somayoga someday?
No way. Absolutely not. I just had no idea this existed, and so it was eye-opening for me and exciting.
Yeah.
And you can see the interpretation of yoga, I think, and there's pure traditional yoga, and then it's degenerated into so many different things.
Mm-hmm.
It's hard to know what yoga really is, and how it applies to maybe making you feel better and relaxing versus actually having a therapeutic benefit, for a disease. I think the pictures you see of yoga are these thin, young, fit women and men doing all kinds of heroic poses, and that's sort of my interpretation. So I certainly never thought that I'd be doing this, and I've learned that this is very different than that. And
so, Dr. Bill, could you, in having Parkinson's yourself, being diagnosed with Parkinson's, could you guide the other patients out there as to when they should come and see Wendy Brom and adopt Somayoga?
Well, if I had my way, as part of the the comprehensive evaluation that they have at the Parkinson Center, I would think it would be very important to add her into that day. Because physical therapy, occupational therapy, speech therapy, social work, to see what else they can provide. And I'm fortunate if I'm not in a position where I need some of those services yet, and to have her as part of that. I think that would, because you need hope in this disease, and yeah. Sorry.
How are you doing, Wendy?
Good.
Thank
you. We've had a lot of fun together. We've
Sure. Do you guys remember the first aha moment when you started the one-on-one consultations or work together? Do you, Wendy, remember like that first aha moment where you were like, oh wow, okay, this is starting to show improvement or progress?
I mean, there's been a lot.
Mm-hmm.
I think it was more exciting for me when Bill would get the ahas,
Mm-hmm.
Because it was really about him reconnecting, right?
Mm-hmm.
And then having, and just, through our time together, for me, just observing his movement patterns changing. He has more function, like his increase in function.
Mm-hmm.
Even last winter, you telling me that you like going cross-country skiing, which you weren't able to do for like a while, right?
Mm-hmm.
It had been
3-4 years.
and then he's diagnosed with Parkinson's in May, and then that winter he goes cross-country skiing. I mean, that's pretty exciting.
That is amazing.
Yeah, and then I also, one thing that has stood out for me a lot too is when we first started working together, the just the amount of tremor that you had in that your right arm down into the right hand, and how that has decreased a lot.
My neurologist told me the medicine's really not going to help tremor that much. It'll help fluidity and movement, but probably is not going to do much for tremors. So that's that's been fascinating.
Yeah.
And also sometimes it's what you don't know that you suddenly realize can be very enlightening, because there are a lot of things that I didn't know I couldn't do. With the group, we didn't have, she didn't have time to do all that, where we would spend an hour and she would give me reinforcement, touching a muscle that was tense and signaling me to release, and helping guide a movement that I just couldn't do myself, and I didn't know I didn't have that movement open to me. So there were a lot of those aha moments where I was like, wow, I can't move my shoulder blade. I can't, lift my shoulder, something that, you might take completely for granted. And I couldn't do it. So I needed her help to kind of give me that sensory motor feedback that I needed to be able to create that motion or that activity. So.
That's very well explained, thank you. That makes a lot of sense.
It's a different kind of relationship, partnership, and I view myself as like just an educator, but also this third person observer, because I can see things that that first person and it can't really see in themselves, right? Like it's harder for us to see that stuff in ourselves. Even I need a third person observer, right? So, and that is the difference, because it's really an exploration of gaining that sensory awareness from within. My goal is for my client to have their first person experience as well. And when you're able to have that, you're able to be more self-correcting and self-regulating. So I think it's really empowering in that way. It's not like you have to rely on somebody else to do something to you. Like you actually, everything, all of the change that's happened with Dr. Bill, he's done, it's been a partnership, but what's really changed, I think, is his perception of himself from within and having the ability to be more embodied in that way. And I think that is just helping to increase your function overall.
I agree.
Do you think? Yeah.
Absolutely.
So the first person experience is really, really good. And I think that's what's really different about this work compared to other kinds of work where it's somebody just diagnosing, telling you what they just see from the outside. This is like, let's go in, let's have you perceive yourself and then share with me your experience. And then we learn from there.
So an active process, not just a passive one.
Yeah.
For sure, and it's very individualized. Love that.
Yeah, definitely.
So Wendy, most people wouldn't think about yoga when working with a Parkinson's patient or having Parkinson's disease, but can you explain how Somayoga is different from yoga?
I'm a certified yoga therapist through the International Association of Yoga Therapists. And the program that I was in to get that certification specializes in Somayoga. And it is a blend of yoga therapy with the neuromuscular re-education of somatics, which seems to really be the missing link in every single person I've worked with, even people who just have chronic pain or, I've worked with people with stroke, I've worked with people who are even recovering from like hip replacement surgery or, aging, the normal things that happen to our bodies as we age, any like kind of arthritis, bursitis, tendinitis. I haven't found anything that this hasn't helped with. It seems to be such the missing link because it allows people, again, if I'm educating them and giving them what to do, if they do it, they are able to self-correct because they're able to sense and feel within. They're able to have better mobility. They become more functional, everything's moving better. And they are able to feel, and then they can, but they're doing it. And so it's like, it's a longer lasting change, right? Because it's not like you can go get a massage and you feel better for a little bit, but when you stay in the pattern that you're in, you're just gonna go back to where you were. This is really allowing people to increase their awareness so they can change those patterns.
Very powerful.
Yeah,
Okay.
so it's great.
Thank you.